Good afternoon, everyone. We now go live to the Yellowstone County Riverstone Health to hear from the Yellowstone County Health Officer, John Felton.
19. Just a few days later, on March 16th, I issued one of the first health officer orders in the state that temporarily closed bars, restaurants, casinos, and other gathering places. That order, its amendments, and most importantly, the actions of all of us in our community, has slowed the spread of COVID-19 and helped to ensure that our two hospital systems, St. Vincent Healthcare and Billings Clinic, had the capacity to treat people who might have become ill with the virus. Statewide, over the last 6 weeks, the governor has closed schools and issued executive directives also to spread slow the spread of COVID-19 in an effort to flatten the curve. It's because of the actions that we have all taken, physical distancing, washing our hands, limiting outings to essential trips, staying at home if we're ill, that we have managed to not overwhelm our healthcare system. Yesterday, Governor Bullock announced that the actions we have collectively taken have been successful to the point that he brought forth guidance to phase in the reopening of our Big Sky state. My current health officer order will expire on this Friday, April 24th at midnight. At this time, I have no intention of issuing an amendment to that order. Going forward, and for the near future, Yellowstone County will follow the governor's phased-in approach to reopening businesses. The governor made clear in his remarks, and I want to re-emphasize here, that the phased-in approach to this reopening is predicated on the premise that each of us continue to do our part, washing our hands, staying home when we're sick, maintaining strict adherence to physical distancing, and following all the elements of the guidance that he has set forth. The governor also makes clear that local health officers retain authority to adopt more restrictive approaches to reopening than his statewide approach based on local need. So what would trigger a more restrictive approach in Yellowstone County and delay our progress towards getting to the new normal and adjusting to life with COVID-19? There are some key indicators that things aren't going well, such as seeing more cases of respiratory illness, having ICU beds in short supply, critical shortages of personal protective equipment, outbreaks in vulnerable populations like long-term care facilities or homeless shelters, or other indicators that our system is being overwhelmed. It's important to remember that in Billings, we are a regional healthcare hub for a population of over 650,000 people. Surrounding states have not taken the same measures that Montana has, and so we need to be aware of what's going on not only in our community, but in our entire service area. Therefore, the things that we've been doing to protect our community's most vulnerable citizens, the elderly, people with underlying health conditions, our unsheltered population, people involved with the justice system, and people who are socioeconomically disadvantaged must continue. The protective measures must continue for those folks. As businesses reopen and people adjust to this new normal, we expect to see new cases of COVID-19. We expect to see more positive cases. We also expect to see more cases of COVID-19 because we're expanding our testing protocols to include more symptomatic people. In and of themselves, additional cases will not indicate the need for more restrictive measures. But coupled with some of the other things we talked about, the burden on ICUs, healthcare, hospital beds, respiratory illness, and personal protective equipment, could result in the need for additional orders at some point in the future. For those of you who are on social media, there's a meme that's been going around the news feeds that says something like, if public health called tomorrow, could you recount where you've been for the last 14 days? This 14-day time frame prior to the onset of symptoms helps us get an idea of where someone might have become infected with COVID-19. Because of our limited movement over the last 6 weeks, most of us today could probably answer that question of where we've been for the last 14 days with a reasonable degree of accuracy. Going forward, all of us need to be able to answer that question as we begin to reopen things. Whether you use online calendars, calendar apps or just the old-fashioned paper calendar. We're going to ask you to keep track of where you've been, when you went, how long you were there, and who you were with. In addition to keeping track of where you've been, for how long, and with whom, it's especially important to track symptoms of illness on a calendar. Do you have a runny nose, sore throat, a cough, a fever? Do you have body aches? As we adjust to life with COVID-19, no symptom is too minor to be ignored. If you track symptoms on a calendar, stay home, wear a mask, physically distance yourself from others, and call your healthcare provider if you begin to have symptoms, we're all doing our part to help keep our community safe. If you begin to feel symptoms, really make sure you know where you've been for the previous 48 hours, who you've been with, and where you spent your time. In the absence of a vaccine for COVID-19, the best we can do is continue physical distancing, testing symptomatic people, contact tracing to identify and isolate people who become ill, and quarantine those who are in contact with someone who has tested positive for COVID-19. By using calendars and other prompts like grocery receipts and tracking your activities, should you become ill, you'll be able to help us identify where you may have gotten the virus and also who might become infected. As businesses begin reopening under the governor's phased-in approach, Riverstone Health has developed resources to assist them. In March, very early on, we developed a tool to aid restaurants, bars, casinos, and other food services establishments to develop their reopening plans. To date, more than half of these licensed establishments have submitted their plans. These plans include physical distancing between tables, operating at half the normal capacity, and other elements that you've seen in the governor's phased-in approach. We've also created a stop germ poster that includes hand washing instructions that businesses can use. We've created cleaning and disinfection recommendations for businesses. Our most recent guidance is for personal care services like salons, body art studios, and barbers. As this phased-in approach continues, more guidance materials will be available, including guidance for churches and places of worship. We want to be responsive to businesses as they open, so please let us know what additional guidance materials are needed. And tomorrow, the Economic Response and Recovery Branch of the Yellowstone County COVID-19 Command will be sharing more tools for the business community. Many times over the last 6 weeks, I've stood before you and said this is a dynamic and constantly changing environment. It still is and will continue to be into the future. As we adjust to life with COVID-19, we will continue sharing information and providing guidance based on the best information we have. As of 8:30 this morning, 76 Yellowstone County residents have tested positive for COVID-19. 57 have recovered from the virus. 18 residents have been hospitalized, with 7 currently hospitalized, 1 in the ICU. And tragically, one of our neighbors lost his life to the virus. As I said, we expect to see more cases of COVID-19 as we reopen, and will aggressively track each of those cases. However, it's imperative that each of us take measures to continue to control the spread of disease. The next step are not dependent upon healthcare or public health or businesses. It's dependent upon all of us in whatever role we fill, whether we're a customer or a worker or whatever role we fill. When you go out, have a plan, track your whereabouts on a calendar, and note if you are having signs of illness. Stay home if you're ill, stay 6 feet away from others, and consider wearing a mask if you're out in public. Failure to follow these recommendations will likely mean more sick people, increased demands on our stressed healthcare and social service systems, and ultimately more families burying their loved ones. But if we all take these actions, collectively we can make a difference. We can help prevent more infections, and we can ensure that our healthcare system isn't stressed and is available to care for people who are ill. And in time, we can and we will get back to a new normal. Thank you, and I'll be happy to answer questions at this point. Yes?
John, Rob Rogers, Village Gazette. A couple of questions that are related to this. First, as we look at this reopening process, I know a number of public health experts have anticipated or do anticipate maybe another spike in the fall. I was wondering if that's something you anticipate, and if so, are there metrics in place that you'll use to decide, okay, we need to put restrictions back in place, or I guess, what does that look like? What will that
So we certainly anticipate having more cases in the not too distant future because of reopening as well as the change in testing. When fall comes, people again will be more active. During the summer, people will be out and about. They'll be camping and fishing and doing all the things we love to do in Montana. The virus spreads when people get together, and that typically happens more in the fall. We don't have a good sense of seasonality of this virus because it's not been through seasons yet. We do know that when we started having cases, it was winter here, which means it was summer in the southern hemisphere. So we need to be very careful. The southern hemisphere got hit pretty hard as well. The metrics that we'll be following will be not only the number of new cases, but the items like I mentioned, things like looking at what the proportion of cases going to the emergency departments that are respiratory. What about the utilization of ICU beds and ventilators? Other important things are going to be the availability of personal protective equipment. What we really do not want to do is have to go backwards, as the governor talked about yesterday. But we do need to be cognizant of that every one of us has a role to play, and we, as your public health agency and the Unified Health Command, will be very forthcoming with the public, letting them know how things are going.
Have you made a recommendation to the school districts in the county as to whether they should reopen? The governor gave them the choice.
I've spoken with School District 2 and their board. I haven't had conversations with the other districts, but School District 2 has asked me to speak to them. That decision is ultimately up to the school board. I think that they're looking at the right things in terms of safety of students, safety of staff, the education of students and how that proceeds for the next few weeks. But ultimately, that decision will be made by the school board after May 7th. Yeah.
make sure I understand correctly, for restaurants with dining areas, bars, for them to reopen, they're required to submit that plan with the health officer.
In Yellowstone County, yes. Yeah. And that plan, they've had, we put out very early, and there's been a very good response to it. We are still reaching out to those who have not yet submitted their plans. It is important to remember that within Yellowstone County, in order for those food service establishments to reopen, they must both be allowed by the governor's order, and they must comply with the plan requirements that we have locally.
Do you foresee any changes in testing capacity or the threshold at which people can get tested?
At this point, we have moved sort of one step down the testing hierarchy. So initially we tested symptomatic people who are high risk, so congregate living, elderly, immunosuppressed, things like that. We have now moved into testing symptomatic people who aren't in high risk groups. At this point, there's not a plan to get into asymptomatic testing, largely because there's just not the testing capacity. It's more on supplies than throughput capacity.
And are you requiring people to wear masks at any point, or is it still a suggestion?
It's a suggestion at this point, particularly for people who are in areas where they cannot assure physical distancing.
I know there's a bit of online pressure to reopen gyms sooner than what the governor's ordered. Do you have an opinion on that?
Let's go to the facts rather than the opinions. The way Montana law works, if there's a disagreement between a governor's directive and a local health officer's directive, the higher standard is what controls. So until such time as the governor authorizes the opening of those gyms, I cannot do that.
Nice not to have that pressure, please.
Any phone questions?
Yes, this is Nikki from Yellowstone Public Radio. Thank you so much for holding this conference. I'm wondering, for people who are maybe afraid that the governor is reopening businesses and lifting the stay-at-home order too soon, what would you say to folks who just think this is all happening too quickly?
I would say that there's nothing in the governor's order that mandates that people go out. It allows. So if there are people who feel that they really don't feel safe going out or they would rather stay home, continue to use the options that exist. Online retail purchases or takeout or delivery, food services. We hope that people will use our businesses in a way that keeps both the business and the customer feeling safe and moving forward.
Thank you.
Do you have any recommendations for hospitals, or have you given them any recommendations on when they would be able to start elective surgeries again?
There's been no limitation or prohibition on hospitals doing elective surgeries. Those are purely internal decisions that our hospitals have made in the interest of assuring that as we went early into this event, to make sure that there was adequate capacity. So that decision belongs to the hospitals, but again, there's been no requirement that they not do those elective surgeries. That was a voluntary reduction in service. Rob?
I guess maybe one last question. The reasons you feel confident in following the governor's directives and not adding amendments to your closure order when it expires April 24th is cases in Yellowstone County have flattened out. We haven't seen stress on our two hospitals in terms of number of ICU beds, and it seems like up until now the county's had what it's needed in terms of personal protective equipment. Is that a correct understanding?
I think that is a big piece of it. I think the other piece that we need to recognize is our local citizenry, whether as businesses or as individual consumers, have been, by and large, very compliant with the requirements. There's no reason that I have to believe that compliance, commitment to compliance is going to change. And as long as people continue to understand that moving forward depends on all of us, I have great confidence in our community that they will continue to move us forward. Any other questions? All right. Thank you all for coming.
Thank you.
Yellowstone County Health Officer John Felton laying out guidance on top of Governor Steve Bullock's directives to open the state yesterday. Here's what he had to say. He says on April 24th at midnight this Friday, his health officer order will expire and he does not plan to implement another. He says Yellowstone County will follow the governor's plan and orders. Now, he says we will expect to see more COVID-19 cases in our community, but he says additional cases will not dictate closures and more orders. He says situations like more respiratory illness, more stress on ICUs and hospitals, at that point they will address potential orders. He says it is important for all of us to just pay attention right now. No symptom is too small to be ignored. He says start tracking as soon as you feel a symptom. Isolate, reach out to your doctor, get tested. The county will also have more guidance for our businesses and our community as we move forward. Join us right back here tonight at 5:30 for more details and response from the community. We'll see you then.